marathon. This is not a sprint. We still have many more weeks ahead of us going forward, and we'll continue to use the data and the facts that we know to help us make decisions each and every day. We have some good news going forward. Yesterday morning, we received a large shipment of supplies from the National Strategic Stockpile. Many of these are needed in our communities, and we're grateful to receive that shipment and do expect more in the coming days. Also, yesterday afternoon, we received news that we will get 10 to 15 of the Abbott ID Now rapid test platforms. This is fantastic. These are going to be testing supplies and equipment that we'll be able to utilize to get instant results for individuals across the state of South Dakota. And we'll put them in populations where we can focus on stopping hotspots and making sure we're getting people answers on if they are positive with COVID-19, and then immediately be able to isolate them and protect more people. We will prioritize, obviously, and be working with our tribal populations and our underserved areas as well. I do want to thank a lot of our folks that are on the front lines, and this includes our doctors and our nurses, our clinics and our hospitals. I also want to encourage all of our clinics across the state of South Dakota to stay open. We've had some that have closed their doors, and we want to encourage them to stay open and continue to provide health care to a lot of these communities that are relying on them for basic services, even above and beyond the virus, that they are incredibly important to us and that we need their services throughout the state, not just taking care of those who might be dealing with the virus, but people that are trying to live their daily lives and get the health care that they need. I know it's an uncertain time for many of those in the healthcare community, but together we will continue to get through this. I also wanted to give you an update on covid.sd.gov. That website has been updated. I encourage all of you to go to it. We have had 1.6 million hits to that website, and we have spent the last couple of days putting a whole new platform out there where you will find all the information that you need dealing with COVID-19 and our response across the state. The Department of Health is still leading the public health information there, but there's so many other agencies and departments that are a part of getting you what you need to continue to take care of your families. The new platform has public health, education, child care resources, business support, reemployment resources, and volunteer resources. All of them are located there, and I encourage you to go to covid.sd.gov and check it out and make sure that you're getting all the information that you need. It includes everything that we've already had, but it's organized in a much cleaner and more thoughtful way that I think that you all will appreciate. With that, we will open it up to any questions that you may have.
Good Wire News. First off, it's great to hear a lot of those positive numbers. So thank you so much for that update. I just kind of wanted to ask a general question. Has there been any discussion about possibly closing any of South Dakota's borders? I mean, obviously not excluding essential travel, trucking, and all that. But has that been in any discussion as far as making South Dakota's numbers more manageable?
It's obviously been a part of discussions, although there has not been a decision made to close our borders at this time. So we use every single day and hour to make, and what we see happening across the state and across the country to make our decisions. But at this time, South Dakota's borders will not be closed.
Thank you, Governor.
Governor Lee with SDPD. Can you talk a little bit about what Senate Bill 191, the bill that would kind of define city and county authorities to respond to this? You know, it died yesterday. Do you have any reactions to? Did you support that bill? And where does this kind of put cities and counties? Do they have that authority to issue the business closures? And they were kind of requesting some backing from the state. Do they have this authority to do so?
Well, the cities have had the authority. They've always had that. We actually drafted the bill, helped work on the bill that would give counties the same authorities that cities enjoy or to participate in. And the legislature at the end of the day decided not to pass that bill. We brought it forward and worked with them on it and were helpful in answering questions throughout the process. But at the end of the day, they did not pass the legislation.
Governor, right before you walked in, TransCanada announced plans to
get a question in the room, and then we'll go to one on the phone.
TransCanada announced plans to continue to build. Can you give us any update, any communications with them, and how you see that Is there a COVID tie into that? How will you manage the influx of people coming into South Dakota?
Well, I had some conversations with the energy company that will be building the pipeline through the state of South Dakota yesterday. They indicated to me that there would not be activity in South Dakota until maybe later on this summer. And so we will continue to communicate with them. They recognize the virus's impact in South Dakota and across the country, and will be working with us to make sure we're making good decisions on not spreading the virus and waiting until it is safe for them to continue the build. Okay, on the phone we have a question.
Hi, Governor. This is Stephen Groves from the AC.
Yeah, hi, Stephen.
So I wanted to ask about the legislature failing to pass first the bill dealing with county commissioners, and then the Secretary of Health powers in a public health emergency. With that, do you as governor have the ability to restrict businesses or gatherings?
So the two bills that did not pass yesterday, one dealt with giving counties the same authorities that cities have. There were several different debates about amendments to that legislation. At the end of the day, the entire bill did not pass. And the cities will have the same authorities that they've always had. The other piece of legislation that we brought forward focused on making sure that the Secretary of Health would have some authorities, and when there was a public health emergency for a specific situation we're dealing with in the state of South Dakota. Just a reminder that we have already declared a statewide emergency. That gives me the authorities that I need to put forward direction for our state and to address what we're dealing with COVID-19 in the state of South Dakota today. If we had to deal with specific situations with large group gatherings or an individual who was positive who wouldn't stay in their home or be quarantined, or individual situations like that, that's when a public health emergency could be utilized. And that bill that we brought to the legislature would give the Secretary of Health some authorities to be able to enforce that. The legislature chose not to give the Secretary of Health that authority, and therefore the bill died.
And in light of that, if it was necessary with the rates of infections, would you be able to, order stay-at-home orders or order businesses to close?
I will use every authority that I have available to me, and I clearly laid out what my intentions and directions are for the state of South Dakota in my executive order that I put out previously.
Governor Seth Tupper at the SDPB. I wondered if you could talk about the small business loan fund the legislature approved yesterday, and how that'll be the same or different as the federal small business loan funds that were approved by Congress, and whether businesses in South Dakota should apply to the state or the federal fund first, and how all that will play out.
Yeah, we're still waiting for guidance on a lot of the resources that'll be available from the federal government. So this fund that was set up yesterday will be focused on getting money out quickly to small businesses that need to be able to pay their bills in the coming month to 2 months before we even start to see how the federal funds will be designated. So it'll be focused on real small businesses in the state of South Dakota, helping get them through this difficult situation that they're in. And we expect that those dollars would go out much quicker than the federal funds will be able to be released in our state.
Governor, related to response, and
We have a question in the room.
we're now seeing spring flooding. James River has begun to rise, warm weather this week. Can you speak to the ability to address two needs and the obvious tie to people potentially having to leave their homes?
Yeah, we did have some flooding over the weekend in different areas and expect to continue to see more of that, especially in the James River region. And then we had some significant rainfall that fell in eastern South Dakota last weekend, too, that will move through the system. It'll be a warmer week. We'll see more melt happening, more water coming down the Missouri River, and then obviously impacting our other tributaries and lakes and streams as well. So the state is prepared for this. Obviously, last year we dealt with flooding the entire year, and we had been working on this as well, knowing we would have a potentially wet spring ahead of us. So we will continue to focus our resources on saving lives and then protecting property behind that. And no matter what emergency situation comes our direction, we'll make sure that our priorities remain that.
Confident you can address both at the same time?
I am. I think that we're always thankful for a dry day. And also these days that come that it warms up during the day but then gets colder at night is extremely helpful. If we can slow down the melt in the evening hours, that's obviously something that would be very helpful. So we've had ideal weather really the last 6 to 8 weeks in South Dakota, as far as not a lot of moisture coming our way and allowing the melt to happen in a slow way. So last weekend was a little bit of a different story. We did see some areas of our state, especially in that James River region, that did see some moisture that impacted them. And obviously in our state, we've got a lot of farmers and ranchers that are out there dealing with livestock and calving season. So we're hoping for more dry weather and warmer temperatures during the day.
Governor Mike Tanner at KWAT Radio. I know in some states, governors have activated the National Guard to help support the fight against the pandemic. Has that been a consideration of yours in South Dakota? And if some units were activated, what kind of duties could they possibly provide?
Well, they already are working with us. We have National Guard members in our Emergency Operations Center. Their planners have arrived and are helping us anticipate and build out our hospital surge capacity. They've been absolutely fantastic. But since January, the National Guard has been a part of the plans for how we're going to deal with this virus in South Dakota. Now, there's a certain threshold that you have to meet in order to utilize the National Guard at the federal level for that recognition to happen, but people in South Dakota should be well aware that our National Guard have been serving us through this situation for weeks and months already. And we're incredibly grateful for their leadership. They come in at times of crisis and need, but also their logistical information and ability to plan and work out systems and get resources where they need to be has just been amazing. So they are very helpful, and I know the Secretary of Health has been utilizing them this week and doing a lot of the modeling and the needs that we'll have to have in place in order to deliver health care in so many of our communities in the coming weeks.
Ma'am, this might be a question for the Secretary. So with the test ramping up and now the quick test coming online, I read that federally they should be able to do 100,000 tests a day. Is that current? Is that about to happen? Is that like, with that ramp up, will that mean that medium low cases will start to be tested and you'll be able to, like, are they eventually going to be testing not really everybody but more people, so the separation will be easier coming down the pipe kind of thing?
Sure. So just to be clear, testing of medium and low priority populations is happening today. The State Public Health Lab is only processing specimens for high priority populations. So just to clarify that, and that's not a change. With more testing capability in the state, more people will get tested. We're going to work on quantifying what that will look like. This technology is brand new, but it's very, very promising and can give very quick results so that people aren't waiting as long as they have to wait today.
Thank you.
And a question for as far as the testing results go, how many are still pending at the out-of-state labs?
We do not have the number of tests that are pending from out-of-state labs or at the system level. That's not any different than how we would manage any other healthcare condition.
Well, the last update we had was last Sunday. There was still about 700, and it was anticipated that those numbers would be updated onto the website as the state level are updated daily. Is that not going to happen anymore?
So the pending numbers that have been reported have been consistently only those pending tests at the State Public Health Lab. They do not include other labs, and that hasn't changed.
Any further?
Hey, Governor?
Yes, go ahead.
Yeah, could you just, this is Jonathan Ellis of the Argus, could you just give me your general impressions of how the last day of the legislature went in your eyes?
Well, we got through it. I know the Legislative Research Council facilitated new technologies being used throughout the day, and there was good debate had, but they got their work done, and I think the ones that were here went home this morning, and the others were grateful to be completed and finished early this morning. Thanks so much.
And you've been listening to Governor Kristi Noem's live media briefing this morning. We haven't heard from the governor since last Friday. Cases are now over 100 in the state of South Dakota of COVID-19. However, Governor Noem pointed out that South Dakota is the last state in the nation to reach 100 cases, but she said we are the 15th in the nation for testing. She also said that South Dakota has received a large shipment from the national stockpile of medical supplies, as well as more rapid Avid ID rapid tests, which are instantaneous tests. We understand that the testing should be more plentiful, more available, and much more quicker. She talked about how the legislature failed to pass a couple of emergency bills involving giving counties more emergency powers to declare an emergency and shut down businesses within counties, and a couple of other things that the legislature did not approve, including giving the Secretary of Health more powers in an emergency. We will continue to monitor what's happening throughout the day in the latest situation with COVID-19. We do know that Mayor Paul Tenhaken will be speaking in moments from the city of Sioux Falls. We will bring you that live where available on KELOLAND television, as well as KELOLAND.com and our KELOLAND news app.